Good afternoon, everyone. This is Kristina Kuprina from Sequoia Wealth Advisors. I know many of you tune into these monthly webinars to get updates on the economy. I've been doing this, for those of you who are new today, since just before the pandemic. Every 2 weeks during the pandemic, then moved to monthly after that, just to give an opportunity for those who are interested to get updates on the economy, strategy, kind of what's going on, but on your schedule. So you register for the webinar, you can be live in person, or you can listen to it later. It's a great way to get a lot of your most important questions answered. As many of you know, we also, about once a quarter or so, we bring in a special guest, because there's only so much Kristina anybody needs, and it's good to hear from other people on other topics as well. So before I introduce our speaker today, we have a lot of registrants for this event, a lot. Most people probably can't be here at the time in the middle of a workday, but there'll be a lot of you listening to this recording later. So I have some of the questions in advance, but I wanted to say for anyone who's live here today, please send in your questions. This is an important topic to a lot of people, and it is something that could be complicated sometimes. So any questions you have, I will definitely present them after the event. So the topic today, and I'll introduce everybody. The topic today is healthcare and retirement. It is, for many people, the single biggest expense, if not the biggest, one of the biggest expenses in retirement is the cost of healthcare. And it can also be rather complicated. And sometimes people just say, well, when I'm 65, I'll have Medicare and it'll be easy. It's not that easy. There's a lot of moving parts, a lot of important things to understand. And if this doesn't impact you, it may well impact someone close to you or someone in your family, or impact you in the future. So we have been very, very fortunate to get a special speaker who I'll introduce in a moment, who has a lot of expertise in this topic. So please feel free to share the recording of this with others. Let's get the word out there so as many people as possible could be successful in this important aspect of retirement. For those of you who are new, my name is Kristina Kuprina. I'm the chief economist at Sequoia Wealth Advisors and portfolio manager. At the bottom of your screen, you see Katie Lindfelt. She is our certified financial planner. Many of you know her, and also has a lot of expertise in this area. This is work that we're already doing for most of our clients. So please, these are just great questions to follow up. Whether you're a client or not, feel free to reach out to Katie or I, or both of us, and we will get you the answers that you need. Our special guest today is Julia Fuentes. She is with Vanguard. And as many of you know, the wonderful thing about Sequoia is we don't work for anyone except the clients. So we get to use the best of the best from all of the different options that are available out there, both in the planning spectrum as in the investment spectrum. And Vanguard has an amazingly detailed and excellent presentation on healthcare and retirement. Julia has come highly recommended, and we were able to get the really great blessing of having her be able to speak at a very busy season for her, as this is open enrollment. She's talking to a lot of people right now. So to have her come out and talk about this, there's also some great calculators and some tools that will be available to you afterwards. And so without further ado, Katie and I are going to, after I go through a little bit of housekeeping, we're going to put our screens dark and let everyone focus on Julia, but please send in your questions. Please send them in, because after she's done, I'm going to ask them so you get the most out of today. So do send them this Q&A. For any of you who came today for updates on the economy, I may do a brief update at the end of today's hour if time is available. Again, the focus today is on healthcare, but doing another one next month on the economy. And you could always reach out to me sooner if you got urgent questions. So with that being said, Julia, take it away.
Thank you so much. Appreciate it. So I am sharing my screen. You should be able to see this. So this is a really important topic. So thank you for attending today. We're going to really get into planning for these healthcare costs, as it could be one of the largest expenses that you face in retirement. So we can't ignore it. We're going to go into the ABCs of Medicare. We're going to talk about the mistakes people make along the way, go into how your income ties into all of this, and wrap up with a conversation on long-term care. So when you think about the two buckets that we need to plan for when it comes to healthcare in retirement, There's the traditional healthcare costs. You go to the doctor, you get your prescription drugs filled. Those top two line items, they're covered by your Medicare plan. But then you have other out-of-pocket costs that fall into this bucket, like dental, vision, hearing aids. Those are not covered by Medicare, and you will have to pay out of pocket. For dental, talk to your dentist. They're the best starting point. The dentist you want to go to, they will tell you if they think you should get an insurance plan and who they work with on the insurance side. Sometimes your dentist offers their own plan to Medicare recipients. So this bucket, you're going to see big scary news articles out there saying you will need $300,000 for your healthcare costs in retirement. But you don't see big scary numbers saying you're going to need $500,000 for your food in retirement. So let's break this down to a manageable number, a monthly or an annual budget line item, not that big scary number. So year over year, we're just going to budget for this. The other bucket on the right-hand side, long-term care. This is a risk. We don't know if we're going to need it. This is for as we age, some of us need help with the activities of daily living. I need help getting out of a chair. I need help going to the bathroom. Medicare is not going to cover you for this. So we either need to set money aside or seek out an insurance policy in case we face this kind of expense. Some people say to me, well, eventually the government is going to pick up these costs. And what they're thinking of is Medicaid. Medicaid aids the poor. Medicare cares for the elderly. So to qualify to have your nursing home fully paid for, you have to have very low assets, very low income. So since we typically don't have a goal of being destitute in retirement, that's not a good plan for us to plan to be on Medicaid in the future. So Medicare eligibility, you are first eligible for Medicare at age 65, and you can enroll 3 months prior to your 65th birthday month in order for your coverage to start on day one of your 65th birthday month. You also have 3 months after your 65th birthday to sign up. This 7-month window around your 65th birthday is called your initial enrollment window. And that's very important because that is the window they're looking at to see if they're going to assess a penalty for you not signing up. I do want to mention there are some people that are disabled that qualify for Medicare earlier, but for most of us, it's age 65. But you might be saying, well, I'm going to continue to work. I'm working well past age 65. I'm never retiring. And I love my work plan. So my work plan is very affordable, quality coverage. Can I just stay on the work plan? And the answer is, it depends on your employer. So if you work for a small employer, 20 employees or less, you're at risk for not having what they call creditable coverage. But if you work for a larger employer with more than 20 employees, most likely you have creditable coverage, which allows you to delay signing up for Medicare until later in life, and you would sign up during a special enrollment period. You will get an 8-month window to sign up without a penalty later in life when you lose coverage. Most people will coordinate that with their retirement date. So, small employer, you may have to sign up for Medicare at age 65. Your insurance might not be up to snuff to meet the Medicare standards, and you'll have to sign up. But others, you have creditable coverage, you can delay. And that also goes for if you're a spouse and you're on your spouse's health plan, your spouse is still working, you can ride that out with them. So a lot of people delay signing up for Medicare, but you'll want to check with your benefits administrator and ask them if you have creditable coverage, which allows you to delay signing up for Medicare until later in life. They should send you a letter. You will have to prove it later when you sign up for Medicare. If you're somebody that says, wow, Julia, you are nuts. There's no way I'm waiting until 65 to retire. I'm out at 60. You're going to need to bridge the gap to Medicare and find a health plan. Maybe you have retiree health benefits. These are becoming less and less common, but some people still get this benefit. And if you have that, that is great. But let's say you don't. Your next option, maybe you can convince your spouse to continue to work and you can retire. But we all know that that sometimes doesn't work out. Spouse number 2 wants to retire also. So this leads us to option number 3, COBRA continuation insurance. What this means is you can continue with the exact coverage you've had it through your employer, but keep in mind this is a short-term solution. COBRA typically lasts 18 months for voluntary retirement. So it's good for somebody age like 63, 64. COBRA, now when you're retired, you have to pay what you were used to paying, what your employer subsidized for you, and an additional 2%. So it gets pretty expensive, which leads to one of the more common options. A lot of people go with the Affordable Care Act marketplace plans. If you go to healthcare.gov, this is where you can price out plans, and it's very important to put your income in there when you're pricing out a plan, because there's elevated subsidies that are getting paid through the end of 2025. So if we can do income planning and get our income low in the years that we're on the Affordable Care Act plans, you can get very affordable monthly premiums and tax credits. But if your income is very high, let's say your income is over $240,000, you might shop directly with private insurers to see if you can get a better network, some kind of better coverage directly with the private insurer outside of the marketplace. But we're going to jump into the meat of the presentation, Medicare, the ABCs, what we call Medicare's alphabet soup. So Part A is your hospital coverage. This is the only part of Medicare that is free. It's free if you have worked 10 years or your spouse has worked 10 years. Now, Part A, there is a lot of people that are delaying signing up for Medicare until later in life. They will still sign up for Part A because it's free. You've paid into the system and it gives you additional coverage and puts you in the system and makes signing up for the rest of the parts of Medicare easier later. There is a reason you would not do that, though. If you sign up for Part A, you have made yourself ineligible to contribute to a health savings account. So if you want to contribute to your own health savings account and maximize that, then you don't want to sign up for Part A. You can delay that, but most people do sign up for it. Part B, this is your medical coverage. You go to a doctor, you go to a specialist. There are a ton of different expenses that are wrapped into Part B. And the minimum that anybody is paying in 2023 for this is $164.90 a month per person. This gets netted right out of your Social Security check. So there's no way to avoid that. If you're not taking Social Security benefits, you are billed quarterly, or you can set up auto pay. Another note about Social Security, if you take your Social Security retirement benefits you take it early, before age 65. Let's say you take it at age 62. You will get automatically enrolled in both Part A and Part B. But everybody else that's not taking Social Security benefits, you must take action and enroll. Part B comes with permanent lifelong penalties if you don't sign up on time. And I'll give you an example. There was a small business owner. He had small employer health coverage that he offered to his employees. It was not creditable. He didn't understand the rules, and he worked 18 years past age 65. There is a 10% penalty for every year that passes. He got 180% penalty tacked onto Part B for life. It can get very expensive. Same thing goes with Part D. D is for drugs, your prescription drug coverage. There is a 1% penalty for every single month that passes that you could have had a drug plan and you didn't have one. And that is based on the national average monthly premium. Going into 2024, it's $55 a month. Now, I see more people getting hit with a drug penalty over a Part B penalty, and here is why. They get the letter from their employer saying you have creditable coverage. You can delay signing up for Medicare. They didn't know to ask, is our prescription drug plan here at work, is that creditable? Am I good to delay signing up for a drug plan? So keep in mind two things we want to check on to protect ourselves. Now, the combination of Part A and Part B is what is called original Medicare. And the risk of stopping right there, which you are allowed to, the risk is there are unlimited out-of-pocket costs to the tune of 20%. So you need to get a $50,000 chemo treatment, you owe $10,000. So a lot of people want to protect themselves from those out-of-pocket costs, and so they pick up an additional insurance policy. The choices for most people are, am I going to choose a Medigap or a Medicare Advantage plan? We're going to talk about both today. But let's say you're a former military person. You might have TRICARE for life that will pick up these costs. Maybe you're working for the small employer we talked about earlier, less than 20 employees, or your spouse is working for the smaller employer. You can use that smaller employer insurance as secondary coverage, or your employer might offer you a retiree benefit. Most of them that I see comes in the form of a Medicare Advantage plan, but it's always good to understand your retiree benefit and what it is. We're going to talk about Medigap first. Medigap supplement plans cover the gap in coverage if you were to only have original Medicare, offered by private insurers like Aetna, Humana Gold, United Healthcare, yada, yada. The list goes on. Part B. The first time you sign up for Part B, you get a 6-month window to sign up for a Medigap plan with no medical underwriting. After the 6-month period, they will do full medical underwriting to determine what your monthly premium will be, and you can be denied coverage. So there is a risk here. The first time you sign up, you really want to think about this because it could be the last time you can get Medigap. Some states have additional protections that the states of New York, Connecticut, Massachusetts don't do medical underwriting all year round. The implication, the Medigap plans are expensive in some of these states. Some states give you protections around your birthday, and they say, hey, around your birthday, you can shop your Medigap plan with no medical underwriting, but you have to have a Medigap plan in place, and you can only go down in benefits, not up. So all states are different, but most states, 6 months from when you sign up for Part B, be it at age 65, be it later in the year, you can sign up for that Medigap plan, no medical underwriting. Pre-existing conditions don't matter. Now, Medigap, again, is alphabet soup. You're going to see all these letters, and the benefits listed are the out-of-pocket costs that you would face if you just had original Medicare. I want to stress here, Medigap Plan A is not the same as Medicare Part A that we just talked about. I'm going to simplify this chart. C and F, as in fantastic, are closed to new enrollees to Medicare. 55% of people that choose Medigap plans choose Medigap G, the really great plan. 40% of people choose Medigap N, the really nice plan. So people that sign up for Medigap plans, like the wide coverage network. You can go to any doctor in the entire country. If they accept Medicare, they will take your Medigap plan. So wide coverage network. No authorizations, pre-approvals. You can just go to the doctor and you're covered. All of your out-of-pocket costs are covered. You don't have to worry about it. But you are going to pay a monthly premium for this, and it could be a sizable monthly premium. So my mother pays $175 a month in the state of Pennsylvania for a Medigap G. It's state specific. Every state has different pricing. So you want to price for your state, but you can see that that covers the 20% out of pocket we talked about. There are deductibles associated with Medicare. You have to pay $1,600 before your hospital benefits kick in. Part B, you have to pay $226 before your health benefits kick in. So you pay a little bit more in January. I do want to mention skilled nursing facility. This does not mean that you are covered for nursing homes. Medicare will cover you for 100 days in a skilled nursing facility if you are improving in health and it's part of your rehabilitation. Once you're in the skilled nursing facility more than 20 days, you owe $200 a day. That's what your Medigap plan is picking up. You will notice that for Medigap G, all of your out-of-pocket costs are covered except for the Part B deductible. Legislation was passed in 2020. The federal government said, we will no longer allow Medigap plans to pick that cost up, hence why C and F are closed. The difference between G and N, for N, you will pay a lower monthly premium. My aunt pays $120 a month in the state of Pennsylvania for N. But when she goes to the doctor, she has to pay $20 for doctor's visits, $50 for the ER, and they won't cover what is called Part B excess charges. There are some doctors that think they are worth more than the Medicare negotiated rates. They can bill an additional 15%. It is uncommon, so a lot of people think it's worth the risk for the lower monthly premium. So that's the alphabet soup of Medigap. So your decision tree, do I want a worst case scenario plan that I can go to any doctor in the country that I want to, but I'm going to pay up on a monthly basis for the monthly premium for that coverage? Or do I want to go with Medicare Advantage? Medicare Advantage and Part C means the same thing. So that's the same. Part C, Medicare Advantage, you can use those words interchangeably. Now, Medicare Advantage is offered by the same private insurers that offer Medigap plans. But when you turn 65, you will get 30 mailers on Medicare Advantage. And I get asked the question from time to time, why am I getting so many mailers for Medicare Advantage? There's all kinds of bells and whistles, a free gym membership, a toaster oven, dinner with a celebrity, 0 monthly premium. There's a ton of different benefits. They're all different. Well, the reason you're getting marketed, you still need to be signed up for Part A and Part B, but your Medicare Advantage company is taking the claims. The claims are being run through the Advantage company for taking you on as a participant. The more enrollees they get paid by the government. They get paid for existing participants every year. So it's very lucrative for insurance companies. The more enrollees they can get, your financial ratings go up. And when your financial ratings go up, you get extra kickers and incentives. So this is a numbers game. How can we get these people to sign up? Now, the reason why you're protected from the unlimited out-of-pocket costs associated with original Medicare is because for Part C, every plan must set a max out-of-pocket limit, and it can't be more than $12,450 in 2023. It can be lower than that. Maybe your Advantage company says it's $8,000. They're all different. With Medicare Advantage, you pay for your care as you go. So I like to use my mother as an example here. She's so easy to pick on, but my mother, she has the Medigap plan. She pays $175 a month for Medigap G in Pennsylvania, and she's very healthy. No underlying issues, no major problems. So she complains about paying the 175 a month. It seems kind of silly that I'm paying this, but my mother is accident prone. She gets in an accident all the time, at least once a year. So I'm going to use her example because this one's more interesting. She gets, I think it was 2021. It was sometime during COVID, not right in the beginning of COVID. So let's say 2021, she gets a poisonous spider bite. It's a recluse spider bite, but we don't know it's a poisonous spider bite. So we don't know where she got it, but she got it somewhere and it's right in her chest. So she goes to her primary care doctor and it's like, oh, I have this little bite, and it's little at that point. And they're like, oh, you should be fine. Here's an ointment. They don't know what it is. They send her home. Over the weekend, she's not feeling well. She goes to the ER. Oh, I'm not feeling well. Hey, I got this bite and it looks like something's happening. So they give her an antibiotic and send her home. They don't know what it is. Well, time passes and she's taking the antibiotic, waiting for it to work. And I go to visit her and she looks awful. Not only does she look awful, her chest, this bite has eaten into her body. It's all black and there's a hole in her chest. And I'm like, what are you doing? She's like, I'm waiting for the antibiotics to work and they're not working. I think I'm crazy. I'm like, you're not crazy. We need a specialist. So we look up dermatologist that specializes in insect bites. We get in right away. The doctor accepts Medicare. They'll accept her Medigap plan, take her right away. So we drive an hour, we get there. They immediately diagnose her, call an ambulance. She spends 20 days in the hospital. They're pumping her with the anti-venom stuff. This was during COVID. It was like a nightmare. You couldn't visit her. It was a mess. She needs a little reconstructive surgery on that hole that had formulated and a year of dermatologist visits. She pays $0 out of pocket for the Medigap plan. She just has to pay her monthly premium. Let's say she had the Medicare Advantage. Medicare Advantage is network based. You go to doctors in the network. You need pre-authorizations, pre-approvals to get things done. So we'll go back, poisonous spider bite. Let's say she's paying no monthly premium for her Medicare Advantage plan. So her primary care doctor is in network. So she goes to her primary care doctor. She's paying along the way. Oh, that's a $30 copay. Here's the copay. All right. Then she goes to the hospital. Oh, you have a $150 copay for the hospital visit. Okay, she pays that. Well, then when she wants to go to the specialist, it has to be a specialist in network. She might have to go back to her primary care doctor to get a referral to the specialist. Then the hospital visit. Oh, geez, there is going to be a big cost associated with that. At the end of the day, with the surgery, the hospital stay, all the care, she would pay up to her max out-of-pocket limit. And who knows if she would have been accepted to be able to go to that specific dermatologist. It might have been an out-of-network doctor. So nothing wrong with Part C. People that are healthy, if my mother never had an accident, she would pay less in a year with a Part C Medicare Advantage plan over Medigap. So nothing wrong with either of them. They're just different. To bring it all together, Part A, your hospital's free. Part B, nobody can escape the $2,000 we all have to pay. Part D, drug plan, $400 was the national average monthly premium for 2023, plus your out-of-pocket drug costs. And then Medigap G, depends on where you live, $1,200 to $3,600 is a good range nationally, very specific to where you live. And if you get in during your open enrollment period, the first time you sign up for Part B, they can only ask you your gender and your smoking status, and they have to give you the best available rate out there. So a starting point for a couple, to say us all-encompassing Cadillac worst case scenario plan, we're looking at $12,000 a couple is a good starting point. But there is a big elephant in the room here. Your income is tied to this entire equation. There is something called the income related monthly adjustment amount. On an annual basis, the Social Security Administration is pulling your tax return from 2 years prior. So for 2023, they're pulling your 2021 tax return. Your 2024 Medicare premium is going to be based off of your 2022 tax return, so 2-year look back. What they look at is your modified adjusted gross income. That is line 11 of your 1040. That's your adjusted gross income, and they add in your muni bond interest. So if you have municipal bonds, be it a mutual fund, individual bonds, any of it, the interest is all counting. It's line 2A of your 1040. They add them together. If it is a penny over 97,000 as a single person, a penny over 194,000 as a married couple, you will pay more on a monthly basis for both Part B, your doctor's visits, and also they will tack a surcharge on Part D, your drug prescription plan. So you can see with higher income, you pay a lot more for your Medicare premiums than we just reviewed. And you might say, oh, I'm going to be under that 194. I'm good. I want you to think about if you have to take a required minimum distribution in the future. If you have Roth assets, you're good. Roth assets don't count towards this. So RMDs will count. You turn on your Social Security benefits. A lot of times, 85% of that is taxable income, hits the tax return. Maybe you want to buy a vacation house and take 300,000 out of your traditional IRA. That hits your tax return. You might have to pay more for your Medicare for that year. Or not for that year, because we just talked about how it's delayed in the future. So it resets every year. Maybe you get an inheritance from your parents and you have to, the rules are a little different these days. You have to liquidate the account over a 10-year period. That can create a lot of taxes and IRMA surcharges. So income planning is very important to work with your financial advisor when they ask you questions about big dollars flowing. Say, like, hey, do you expect anything to come in? They're trying to plan for things like this. And to wrap up, we're going to talk about long-term care briefly. We already talked about how Medicare doesn't cover these costs. Depends on where you live, what these costs will be, but we all know it can get pretty expensive. A lot of people that enter a nursing home, they die within 3 years. But we're starting to see more cases of Lewy body dementia, Alzheimer's, things that are extending these nursing home stays. And we see a risk, especially with women, that 9% of retirees can expect, 9% of women retirees can expect to need paid long-term care for more than 5 years. And the reason women have more longevity, women tend to take care of their husbands, and then no one's left to take care of them. Although half of the people out there have no paid long-term care, a lot of people are fortunate to have children willing to quit their jobs to care for parents. So some people have that support network. But if you don't want to rely on that support network, 18% of retirees can expect to pay more than $250,000 in this bucket. A lot of people need $100,000. So this is very customized to your specific situation. So talk to your advisor. Do I set money aside? Do I look at insurance policies? There's a lot of life insurance policies with long-term care riders that exist these days. Your advisor will help you to determine your situation and what's most appropriate for you. So what I want you to do with this information is on an annual basis, do income reviews with your advisor at the end of each year. IRMA notices come in November. Talk to them about the insurance policies you have and budget for your health care on an annual basis. Once you're on Medicare during open enrollment, October 15th to December 7th are the dates every year. It's the one time a year you can change your Part D drug plan and your Medicare Advantage plan. So it's all about Medicare Advantage, Part D drug plans. You have to look at them, see what's changed, price the plans, because year over year, sometimes drugs are dropped. Your drug's not going to be covered next year. Sometimes networks change. Your doctor left the network and costs change. Oh, your deductible is $1,000 higher. The out-of-pocket costs have gone up a lot. You want to protect yourself and do your homework every year. If you don't have healthcare directives, great idea to get them in order because we can all be incapacitated at any age. And if you still are working and you have access to a health savings account, you can fully fund these costs in retirement, including that long-term care bucket. So it's a great savings vehicle. So talk to your advisor about saving strategies for these costs. So with that, I can open it up to any questions. I see one question in here for, does it usually make financial sense for a non-working spouse to enroll in Medicare when the working spouse is not yet eligible for Medicare? So that is really dependent on your situation. And here's why. So let's say the working spouse is making a lot of money that results in IRMA surcharges. In that case, I typically see the non-working spouse ride on the spouse's creditable coverage, assuming they work for the larger employer. I typically see that just because the IRMA surcharges make Medicare more expensive, and your work plan, your work is subsidizing half of your costs, so it's a big benefit. So, but then I've seen the opposite where maybe somebody's work plan isn't very affordable. They get a low subsidy from their employer and they look and they price out Medicare. They're not getting hit with IRMA surcharges and they say, wow, that's about the same price that I'm paying now and I'm getting better coverage. I'm going to go on Medicare. So it's really dependent on like your specific income and situation. And then I see one more question. What is the optimal age to sign up for Medicare A? So for Medicare Part A, if you are not contributing to a health savings account, the optimal age would be 65 to sign up. And you can sign up 3 months prior to 65. If you are contributing to a health savings account, you would not want to do that. You would want to wait until you retire and you're going on Medicare.
So a couple of comments that came across. One was great storytelling. So, and it made me think that maybe I should ignore those bug bites anymore.
You never know.
Working out my land and all sorts of little critters that biting at me. Yeah, that's just,
yeah.
This is the story right there. A couple comments was there was a comment that it seems complicated and there's a lot to it, and there was a couple of comments along those lines. So I did want to just, if I may just kind of bring something out, is for any of you that are clients of Sequoia, we will help you with this. We will do this work for you. We will do the calculations. We cannot tell you which insurance to buy, but we can give you the information you need to know what's going to be best based on your situation. It's not as simple as you turn 65, you do this. There's so much more to it. And something very important that Julia talked about, something that Katie and I are really diligently watching with our clients' plans, is your taxes. That's why we ask a lot of these questions. It's why Katie does tax analysis and we look closely at those numbers, because it does have an impact. And a common thing that we've seen is people that don't have people like Katie and I advising and guiding them through this process, or seeing their entire financial picture, is think about a common thing people do in retirement. They want to sell their house. And then shortly thereafter, they retire. Well, guess what happens to that year's tax return, especially for our clients in California, right? It's a big deal. It hits them on the tax side of it. How much do they keep after taxes? But it also hits them on what the cost of Medicare will be going forward. So no decision is made in isolation of understanding the entirety of the financial picture. So please, for those of you who said it sounds very complicated, you have us. We will help you. If you're not a client of Sequoia, you can hire us to do just the planning. So we offer that service. So if you just want to figure out a few things, we could do financial planning for you. It's just so incredibly important, because if you think of it this way, when you take that moment in your life, when you go from living off what you've earned, you're working and you're earning at the same time, and you're spending and you're working and you're earning all at the same time. The minute you take that step into living off of what you've saved, I can tell you, it doesn't matter how many zeros are on those accounts, it is a very uncomfortable moment. Very uncomfortable moment. The greatest fear people have is, am I going to outlive my money? And sometimes people have more money they can spend in lifetimes, and that still's there. So the more you can understand about what these non-negotiable costs are, and the more you can understand what you may be able to do to minimize and mitigate them, the more comfortable you're going to be when you step off that ledge into the retirement, or as Katie and I call it, the work optional lifestyle. So it's very important, but please know you don't have to figure this out on your own. You can certainly talk to us. Again, if you're a client, this is part of the services we provide. If you're not, you can hire us simply to do that. And I do want to stress my incredible gratitude, Julia, for you. I know your schedule is very busy, especially this time of year. And Katie and I really thought this would be important and valuable information for our clients and also other people that they know. And I really do appreciate the fact that you could share your incredible wisdom and knowledge and resources with us. There was something that was mentioned before, was there's a calculator. Is there a link? You have a calculator, or you have some additional resources that people can use? Or is that something I should speak directly to the team about?
Yes, we do have a healthcare cost estimator tool. It was really built for a financial advisor audience, so it's on our financial advisor website that you have access to. But we,
well, that's good to know, because we can also, if you want the report run, again, reach out to Katie and I, and we'll be able to do this for you. Just if you just want to just kind of see just that little area of your plan. Again, this is part of our financial planning services. But that's a very good point. It's better to not do it in isolation, because sometimes it may not calculate other things outside of this, which could actually change the numbers. And you certainly don't,
if somebody looks at income and they put their income when they're working full time, not their retirement income, and it could mess up the entire number because of IRMA surcharges. So yeah,
those are big things too. And this is also coming back into financial planning, why it's so incredibly important to look at things holistically, not look at a portfolio or look at taxes or look at insurance or look at real estate or anything in isolation of everything else, because it's all connected. It's all interconnected. And there's a very good example that Katie and I are constantly watching. As a retiree living off the income of a portfolio, especially our clients in high tax states, it can be very, municipal income could be a great advantage because you have income that's not taxed, but it's not going to help you on the Medicare side. So do we make some portfolio adjustments in advance of that? All of these things fit together, and they're all incredibly important to this. I just wanted to step back for a moment and see, Katie, did you have anything you wanted to add to today's presentation?
Thanks for sharing all this, Julia. I thought it was real helpful with some of the pieces we cover with clients day in and day out. Your big picture numbers, looking at, here's kind of just some overarching numbers to think about. I found really as a helpful starting point as people are looking at their retirements there. And also you pointed out a few other pieces that we really recommend to folks. Make sure you have those advanced healthcare directives in place. That's a piece of an estate planning tool. There's also ways and resources to get a hold of those if you haven't done more comprehensive estate planning, because we can pay for all of this, but when the emergencies come into play and we need our families to step in and help us, having those pieces taken care of really simplifies things. So if you don't have that taken care of and you need some guidance, reach out to us. We've got some good resources there for you as well.
And I'll add one thing as well. we're going to be posting this presentation once it goes through all of its required compliance review on our social media. So Sequoia does have social media access through LinkedIn. We have a YouTube channel. We also have through Facebook. Sorry, I'm not always the best with the social media aspect on the more analytical side of things, but this is available. So please visit our social media. Please visit our LinkedIn. Please visit our Facebook, YouTube channel, and you can share this link with friends and family and people you work with, people you know, because again, this pretty much impacts everybody in some form or another. It's really important to get this information out there because Katie and I have done planning for people that have made these decisions without seeing the big picture and been trapped in these very high expenses for a long period of time. And you know, you sell your house 1 year and you look wealthy on paper and you sit in that highest level, but that's it. You're not going to keep earning that money, but you're trapped. So it's really, really important to think about all of these things. And when a life event happens that's unexpected, like an inheriting of a beneficiary IRA, how do we mitigate that to as best as possible? There's some strategies. There's things that can be done. It's not, oh my gosh, I have no choice. It does through careful planning. So that just comes back. We really want to get the word out there so people know their options. Whether they work with us at Sequoia or not, at least they have the tools they need to make really, really good decisions. And that's important. I did want to add something to what Katie said as well, a little bit outside of healthcare and retirement, but those advanced healthcare directives can also be really important for your young children as they hit adulthood. So imagine that your young one, your 18-year-old just went off to college, and let's say they had an unfortunate accident while they're at college and they're across the country, and you call the hospital because you want to make sure your child's okay. And they're like, we can't talk to you. They're an adult. You have no access into the information any longer. You can't step in as parent. Well, they would probably want you to know how they're doing, and you would probably want to know as well. So you can set this up. It doesn't just have to be for yourself as you're older. It also can be with their consent, obviously, for your adult children, especially as they head off into the world. So again, off the topic, but again, this comes back into financial planning, all these things that we didn't always think about. And hey, doesn't mean they're doing crazy stuff. You heard about that spider. So there's all sorts of little things that can come up in life with things like that. So that being said, with all of this, as I said, this presentation today, it's our highest intention that each and every one of you that are both listening live and also that listen to this later get value out of this. And we will be posting it onto our YouTube, onto our social media, and also onto our website when it becomes available. For those of you who registered, you'll also be getting the recording within a day, so you'll be able to share that one as well. Julia?
Yeah, I see one more question in there.
Oh,
Did you want me to answer that last
yes,
question?
please. Yes, please.
So it says, I have Part A and Part B of Medicare and a separate plan for vision and dental. Can I save if I add Plan C? So with this one, it doesn't say if you have a Medigap plan. So I'm thinking you might just have original Medicare. So if you just have Part A and B and no supplemental plan at all, a lot of times with Plan C, they come with a monthly premium. It's usually pretty low. There's a lot of different plans. Some of them aren't always low. When it comes to vision and dental, and I'm not saying this, so this is coming, the words of my dentist are being channeled out right now. She said, well, Medicare Advantage plans, you can only go to strip mall dentists because it's like network-based dentists. So you typically can't go to any dentist you want to. It would have to be the dentist in their network. So maybe one of the big ones that you see in the strip malls across the country, like that's the kind of dental you get. So if you have a specific dentist you really like to go to, you'll probably find yourself buying the separate dental insurance anyway. And same type of thing with vision. So for vision, a lot of people just pay out of pocket for their eyeglasses. You know, it might be like a couple $100. The eye exams a lot of times are free. So a lot of people decide in retirement, oh, I'm not even going to have vision because if I have a problem with my eyes, I need cataract surgery. That's going to be covered by Medicare Part B. So it's that question, it could save you money if you have no other supplemental plan and then you get sick. You could find yourself paying less because you'd be on the hook to pay 20% out of pocket now. But it all depends on, you know, what plan you have. Wait, can you address
this is one piece I wanted you to address, Julia. So glad.
Okay, can you address the question of moving from Advantage to an Alphabet or Alpha to Advantage? Once you choose one or the other, are you locked into this track? You are not. So you can go during Medicare's open enrollment. So it has to be between October 15th to December 7th of each year. That's your one time that you can make a switch out of Medicare Advantage into Medicare Advantage. So if you're somebody that starts with the Medigap plan and then you decide this is too expensive, I want Advantage, you can switch to Medicare Advantage during open enrollment. Vice versa. Hey, I'm in Medicare Advantage and I really wish I did Medigap. You're going to have to apply for the Medigap, see if you get approved, and you can apply for the Medigap throughout the year. It doesn't have to be during open enrollment. See if you get approved because they can deny you depending on your health situation, or they can price you really high if you have a pre-existing condition. Once you're approved and you think it's reasonable and you want to go with it, then during open enrollment, you can leave your Advantage plan, join the Medigap plan. So you do have choices that you can switch your plan like once a year during open enrollment. And then with Medigap, you can change your plan. If you're really healthy, you can go through medical underwriting and try to price it around your policy anniversary each year if you want to go through that. A lot of people kind of stick with them for long periods of time.
All right, any more questions? Any more questions? It's 8 minutes to the hour, so I just want to make sure everyone's questions get answered. It doesn't look like we have any more. If someone watches this later and has questions, reach out to us. I'm sure we can reach out to Julia, her team, or Katie knows much of this too as a certified financial planner. We'll definitely get your questions answered for you. Again, if you listen to this later and can ask the questions live. So again, just tremendous gratitude. This is a wealth of information that you've shared with us today. And it's just a great reminder, again, the importance of planning and thinking about these things ahead of time. The early thing that you mentioned about that person that keeps working and missed that period of time and have those onerous penalties. That's really important because many of us are working well beyond traditional retirement age. It's not uncommon nowadays. We're living a lot longer. So that's an easy mistake that can be made, especially if they're not aware of the creditable requirements. I think that's a very important thing. So if you are listening to this and you are an HR person, that's a good thing in the communication with your employees as they get close to that age, as well as if you're an employee that plans to continue to work longer, is to really make sure that you know the answers to these things. So that was really important information there as well. Okay. Thank you. Well,
yes, thank you so much.
Well, thank you as well. So for anyone that's listening, I'll just take a moment or two to say that I'm going to talk about the economy on the next webinar because I feel like it needs a lot more time than 5 minutes will provide. I will say that we at this point are pretty much tracking, as I've been talking about throughout the year, of what will be happening with the economy, and there's not been any major or meaningful changes. However, there are a lot of changes on the individual company and sector level. So if you knew how many hours a week I am spending watching closely your portfolios and making changes where necessary, it's a lot of time and a lot of work now because we're going through major shifts in the economy going into the next stage of the cycle. Because of that, if there's anything important that has changed in your life, okay, this is really important as we approach the end of the year, please let Katie and I know. It could be income changes. In other words, you're really being impacted by inflation and your spend needs may be going up, or money has come in unexpectedly and that changes what your needs are going to be. If anything has changed in your life, please be sure to reach out to us. We're happy to schedule a time to talk with you because we're making all of our adjustments, both on the portfolio and the planning level, based on what we know about you. And sometimes when big life events happen, the first person you think to talk to is not necessarily your financial planners. So please do let us know. Also, if there's anything expected to really change next year, as well as we're positioning into planning for 2024. It's going to be a really different year next year. So that being said, really important to let us know. Katie and I spend phenomenal amount of hours behind the scenes watching these things and making adjustments as necessary. The missing piece could always be something happened and we didn't know about it. But on the economics end of it, like you said, adjustments happening. There's not been any major changes. And on next month's webinar, we'll go into more detail. In addition, we're still intending to do our live event as we do every year. Instead of December, we will be doing it in January due to scheduling complexities with the speakers as well as us, and the fact that you probably don't want to come see our event around the holidays. So that being said, still plan to do it. And again, as I said before, greatly appreciate all of your support and all of the work that we do. It is a true honor and very meaningful on a deep level, the work that we do for you every day and throughout your lifetimes, your parents, your children, and helping you collectively as a family through life's more challenging times and through the great events of your lives. All of this is pulling this all together and helping you be successful is incredibly fulfilling and important to us. So thank you very much for your support, being with us here at Sequoia. And if there are any other topics of interest to you, think that would be very valuable, like we did today, healthcare and retirement, please let us know. We have access to a lot of really great speakers and a lot of subject matter, a lot of different expertise. We will bring them in. And that is the advantage of the work we do and the relationships that we have. So just let us know what's important to you. And we'll either do a personalized presentation with just you, a small group of people, or we'll do a big webinar like the one we've just done. So again, thank you all very much. Have a wonderful rest of your day. And please follow up with us if you have any more questions. Okay, bye for now.